Hello, I'm Dr. Pramod Bhor, Director of Orthopaedics at Fortis Hospital Vashi. Uh, Today I'm going to talk upon how can early detection of joint wear reduce surgical need in an elderly patient. So basically, early detection means the detection doesn't happen at an older age group. It has to start early. Early means when you are a young person and you have a knee pain, you should consult a doctor, consult an orthopedic surgeon, and go for early diagnosis. Now, how does this help in the long run? So, whenever anybody has, so specifically in our scenario, many of the people normally tend to ignore the knee pain whenever it starts early, or the hip pain whenever it starts early. Why do we say, okay, sometimes it is going to pain and then it is going to reduce? So, any injury or any kind of ligament imbalance that happens in the joint, if it is goes unnoticed, is going to cause more wear and tear of the joint. Wear and tear means either the meniscal tear is there or the ligament tear is there. If that is not, the knee is not balanced, there is more loading in the joint, which causes loss of the cartilage and early osteoarthritis. So whenever the joint is going to be worn out early, there are more chances that you require a replacement surgery, which is a major surgery. So how do we prevent these major surgeries by early detection? So whenever a patient comes to me having a knee pain, I do examine the patient clinically. Once we see the patient clinically, we know to what degree the problem is, whether the patient is having a ligament sprain, whether it is the patient is having a tear in the meniscus, and accordingly the treatment can be addressed. Once we address the treatment, the patient gets treated completely. These are basic physiotherapy, basic medicines and exercises. The patients can be treated. Once they are treated completely, the joint goes back to normal, and the osteoarthritis can be prevented in the long run. If this does not happen, the patient still feels better for after a few days. The pain does definitely reduce even when not treated, but the imbalance doesn't go away. When the imbalance doesn't go away, the meniscus, which is torn, is hurting the cartilage. If it is left untreated, though the pain has reduced, if when left untreated, it is going to cause wear and tear and going to cause trouble later. So it is better to treat it early, detect it early. For early detection, the basic investigations that we need is basic X-ray of the joint. If need be, if indicated, definitely an MRI of the joint will help. So these are a few reasons why you should not ignore your joint pain when it starts early, because if you are ignoring it at the age of 30, 35, 40, then later on at the age of 50, 55, your joint is going to be worn out, and once your strength reduces, once your overall strength reduces, the bone strength reduces, you are going to require a replacement, major replacement surgery. So to avoid major replacement surgery and at an elderly age group, you should take care. So whenever it is going to give you, whenever it starts, so take care of the prevention is the best medicine. Definitely everybody knows that, but we do not act on it. So start acting. It is better to detect it early and stop osteoarthritis from increasing. Thank you.